A lot of what we do, especially in the world of palliative care, we love to have the informal caregivers a part of what we do. They're a huge part of the conversation, both when we're discussing the goals of care type discussions and then also in terms of symptom management. They play a role in helping the patients obtain the medications a lot of times. So sort of serving as an advocate for them in settings of prior authorization and things not being covered, but also in monitoring the patients and determining whether we're doing our job in terms of meeting the patient's goals when it comes to the therapeutic efficacy. Are they able to improve their functionality based on our recommendations, and also helping to monitor for indices of toxicity as well. All the time. So I cannot tell you the number of times I've encountered other healthcare providers, whether it be attendings, nurses, really running the gamut on the team. From the ICU to the general medicine wards, saying, my patient only has COPD or they only have stage 2 cancer. They're not imminently dying. We don't need palliative care. So it's really a missed opportunity where we could play a big role in helping to improve the patient's quality of life and helping determine what needs are not being met. And a lot of times what we do is sort of serving as that middleman and helping coordinate who do we need to get involved here. Maybe it's a social worker. Maybe the biggest issue the patient has at this point in time is related to goals of care. Do they discussing their code status or something along those lines? Or maybe it truly is symptom management and there's something from an interventional standpoint. So maybe we need to get anesthesia and the interventional pain team involved. And a lot of times the primary teams are not necessarily doing those things. So we sort of play a role there. But I do think there is a huge misconception about what we do and that palliative care is not hospice care. Getting our foot in the door. So explaining to patients and their caregivers who we are, what we can bring to the table. No, we're not hospice, but we're here to help better manage their symptoms and hopefully in doing so improve their quality of life. So I think that's sort of the first step, and once that's understood, we can go to work and help better manage whatever symptoms they're experiencing. I have a lot of concerns in today's landscape with regard to pain management. So, I think everyone wants to be able to practice at the top of their license, whatever their license may be, to gain more knowledge from people ranging from physicians to policymakers and lawyers to nurse practitioners and pharmacists, physical therapists, like the list goes on. And we want to gain that knowledge so that we're able to apply it to our field and really practice at the top. But when we're dealing with things like prior authorizations that can take 3 hours of your day, my patient volume is not changing. So, do I stay 3 hours longer to still, meet that demand and the need? Yeah, a lot of times that's what we're doing. So, I think, with the advent of the CDC guidelines in 2016, it was a couple of years ago, all of the insurance companies have really jumped on that bandwagon and are making it very, very difficult to continue regimens that have been effective for years sometimes. So, I've seen patients go into withdrawal because they're not able to get their medications, or, elderly patients having to drive to 5 different pharmacies to get a hold of their medications. So it's affecting both practitioners and patients from that regard. And the other thing is patients, there's such a shortage of pain specialists that, either on one hand, there are practitioners that are not pain specialists saying they are, and that's a little bit risky in my opinion. And then there are other situations where patients cannot get in to see anyone. So then their needs are not being met. So I think we have a lot of conflicting needs. I think everyone agrees that, you know, the opioid epidemic is here. It's, you know, we can't deny that, but I think it's adversely affecting our ability to do our job and manage our patients the way that we've been doing and as effectively as we can.